Hi, I'm Dr. Vincent Simokovich, and I'm a chiropractor with over 20 years of clinical expertise. You're probably online right now because you or someone you love suffers with headaches, and you've probably reached the end of your rope trying to find a solution. If you're like most headache sufferers, at this point you've probably been through a laundry list of different medications trying to get rid of your headache pain. And right now, you're hoping to find a healthcare professional, someone who not only understands what causes headaches, but someone who has had success in treating people with this type of problem. If you're tired of taking medications that do nothing but cover up your symptoms, and if you're looking for real solutions that get to the cause, the root cause of why you're having your headaches, I want to assure you that we've had phenomenal success in treating people with headaches, and you're probably not going to have to suffer any longer. Now, many people suffer from chronic headaches which can be caused from stress or tension, but the latest medical research reports that many cases of chronic headaches are caused by a problem in the neck. And these type of headaches are often misdiagnosed or unrecognized by physicians. These type of headaches are known as cervicogenic headaches since they have their origin in the neck or the cervical spine. They arise whenever the joints, the nerves, or the muscles of the neck are injured or strained. Pain signals from the neck can get mixed with the nerve pathways of the head and face, and they can create pain in seemingly unrelated parts of the body. Cervical spine dysfunction can cause pain in any part of the head, and cervicogenic headaches are usually focused on only one side. These type of headaches can last for many hours or days and are usually described as a dull, aching pain. Medication may relieve the pain temporarily, but if the root cause of the pain is not eliminated, the symptoms will just return down the road. The migraine headache is perhaps the best known special type of headache. Symptoms with migraines include dizziness, visual problems, spots before the eyes, redness, swelling, or tearing of the eyes, muscle spasms, irritability, nausea, vomiting, and constipation or diarrhea. These symptoms often arise before the headache hits, and the headache itself may last for a few minutes to a few days. The severity in a case of a migraine may range from a minor discomfort to an immobilizing agony. The migraine pain is almost always in the temple, but it may be experienced anywhere in the head, the face, and the neck. Another type of headache that's closely related to the migraine is the cluster headache. Attacks from cluster headaches come on abruptly with intense throbbing pain and tend to occur from once to several times a day in clusters that last for weeks or even months. Without apparent reason, the cluster subsides just as quickly as it began. So what puts the ache and headache? The pain-sensitive structures of the head are the culprit. These are the arteries of the brain and the skull, the tissue surrounding the head, the covering over the brain, and nerves inside the head called the cranial nerves. When these parts are inflamed, stretched, pulled, or under any pressure, any type of headache can arise. The latest migraine research has yielded a mechanism called cortical spreading depression, or CSD for short. Prior to the onset of the migraine, researchers have observed a sudden burst of cortical activity that occurs most commonly in the occipital lobes, or the back part of the brain. The occipital lobe will increase in the frequency of firing or have a burst of activity, and then there will be an episode of silence or depressed activity. The actual activity of the brain becomes depressed when compared to normal. The resulting pain comes from either the brainstem activation or from blood vessels that are inflamed by rapidly exchanging blood flow, or both. Hi, I'm Dr. Vincent Simokovich.
And I'm Dr. Sam Galati. If you're suffering with headaches and you've given up trying to find a solution because you've tried everything, we want to help you. Our approach to the treatment and prevention of headaches and migraines starts with a comprehensive neurologic examination to determine which part of the nervous system is not functioning properly. Now, in many headaches and migraine patients, we may find a high mesencephalic output. The mesencephalon is at the top part of your brainstem. A high output of the mesencephalon will cause an increased pulse and heart rate inability to sleep or waking up from fitful sleep, urinary tract infections, increased warmth or sweating, and sensitivity to light.
Along with a high mesencephalic output, you may have a decreased output of the cerebellum. The cerebellum is in the back part of the brain and it controls balance and all of the involuntary spinal musculature.
There may be a misalignment of the vertebra in your neck, putting pressure on the nerve roots or your spinal cord. This is referred to as subluxation and can be detected with an X-ray. There also may be a metabolic component to your headaches. In that case, we perform a series of comprehensive lab evaluations to investigate the function of every system in your body. Basically, we leave no stone unturned in uncovering the root cause of your headaches.
If you would like to learn more about our highly successful approach to treating migraines and headaches, fill in the information box below and we will send you a copy of our newly released DVD that explains our approach in detail.
We look forward to helping you get your life back, free of headache pain.
I'm Dr. Simokovich.
And I'm Dr. Galati. Thanks for watching.